Welcome to another episode of Coffee and Conversation, AI in Healthcare. My name is Michał Urbanowicz. I'm a medical doctor and marketing leader here at Infermedica. Today, we are thrilled to have Dr. Robert McGrath, the Chief Medical Officer at NIP Group, which provides health and medical insurance to over 1.5 million Australian and New Zealand residents and empowers members to make better decisions and improve health outcomes through greater accessibility to affordable health services and information. Dr. McGrath is an experienced medical director with a rich background in healthcare management and service delivery. We'll be discussing the challenges in the Australian health insurance industry, the impact of emerging technologies like AI, and much more. Dr. McGrath, it's a pleasure to have you. Can you please tell us more about yourself and your experience?
Yeah, of course. Thanks so much for having me. A little bit about myself. I grew up in a small country town in Australia from pretty humble backgrounds. I joined the military as a teenager and initially trained as a maritime warfare officer and studied economics and information systems. I then later on in my military career retrained as a medical officer with a clinical focus on general practice and underwater medicine. Not me underwater, but treating divers and submariners. It's often a question I get. And then through that career, moved into some medical administration roles, overseeing initially the Australian Defence Force Health Services contract, and then through a number of roles in another large Australian health insurer before arriving at NIB a little over 2 years ago, where I'm the Group Chief Medical Officer. But my career in health has been shaped around my education and training in information systems, technology, economics, and primary care predominantly.
Thank you. Perfect. So we will jump straight in and try to learn more about Australian perspective on health insurance. Dr. McGrath, you've had an extensive career in both the health service delivery industry and healthcare management, as you mentioned. What are some of the biggest challenges currently facing the health insurance industry in Australia, and how is NIP Group addressing these challenges?
Yeah, it's a big question. Australia is subject to the same types of pressures that are being experienced internationally, and maybe one of the biggest of those is the rising healthcare costs and affordability and value, particularly in healthcare. And NIB as a health insurer, we're particularly exposed to ensuring that we promote value for our members. So, we want to encourage value in our products and make sure that people are getting value from the health service, and that's a pretty similar challenge across the world. Similarly, we're also faced with healthcare and particularly medical workforce shortages. We just had some stats released last week that only around 10% of our medical students are intending to pursue a career in primary care and general practice, which is a small fraction of what we would have experienced in the 80s, where up to 40% of medical students would be going into general practice. And that's really driving the direction of our healthcare and limiting access to primary care particularly. We have a very fragmented health system in Australia. We have a good health system. We have good outcomes for our health expenditure. We have a public and private hybrid model to healthcare and funded through the federal government, the state governments, and equally through private governments. And I guess that's not a problem in its own right, but that leads to fragmentation of health systems and health data, which makes it difficult to leverage the benefits of comprehensive health data analytics and particularly AI. From a health point of view, we have an aging population. I guess baby boomers is the term that we use in Australia. I'm not sure if that's a common term overseas, but a large population of people that are reaching retirement age and living longer, essentially, and proportionately fewer taxpayers, which creates this pressure on our health system. So that's a big pressure. Around 2/3 of our population overweight or obese, and again, that's a pretty consistent global phenomenon. And we're seeing lots of advancements in how we approach healthcare through new medications and GLP-1s, particularly. But that's certainly a problem that we're all faced with. And mental health pressures. We have difficulty accessing mental health services and people are challenged more so with their mental health needs in Australia. And all of these pressures are creating, in some places, even greater health inequity, particularly in marginalised populations across geographic, demographic, social and socioeconomic divides, and some of those populations are disproportionately affected by all of those pressures. So lots of pressures, but NIB, we're focused on becoming a more active partner in our members' healthcare and ensuring that our members can get the best value possible out of their healthcare and have healthier and happier lives as they get to retirement age and need to access healthcare more and more.
Mm-hmm. I see. The problems, the challenges that you mentioned, we are seeing the same things I think in Europe, especially aging population, and the shortage of medical staff is something that is really burning health systems and health providers and payers, also in what we can see here. But we are trying to find some solutions, especially using technologies. So with the rapid advancement of technology and healthcare, how do you see new technologies, particularly AI, transforming the health insurance landscape in Australia? And can you share any specific initiatives or projects that at NIB Group that leverage AI to improve service delivery or patient outcomes?
Yeah, I think if we talk about health more broadly, because obviously health insurer, we're a part of that system, there's a number of different places that AI and technology can have quite a dramatic impact. And I try to categorize them in my own mind. The first of which is the provision of clinical care. We're seeing lots of diagnostic tools and clinical decision support systems that can support clinicians in providing care to their patients. And I think that can create some efficiency and some confidence over time in the way in which they provide that care. There are some health solutions out there. We're seeing, for example, Wiser, which is a mental health chatbot out there, which is a sort of human out of the loop interaction. And, that has some challenges in terms of the regulatory landscape, but the direct provision of healthcare, I think, is a frontier. These are just examples, not necessarily things that NIB is doing. And then you also have these tools that can listen in on a medical consultation, transcribe notes, and help doctors and nurses and health professionals to transcribe letters and documents, which can create some efficiency in the way that they provide the healthcare. And I put that all into the provision of clinical care. I think more broadly, there's great opportunity for the way that we explore our health data to understand the risk that people might be exposed to at a personal level. So predictive analytics and risk prediction, I think there's a great opportunity for health insurers to really leverage that to personalise our care offerings to our members in a value-based way. And I think we're just kind of getting into that space. And then there's the kind of process and operational efficiencies in terms of the way that we handle our claims to create efficiencies in the system, which is another group that we're focused on. I mean, we've focused in some places on that clinical support and using digital symptom checkers to provide our members advice about where and when to access care to create some efficiency in the front end as a support and ideally an entry to a system and a pathway that's more efficient and effective. So as well as some other use cases, I think the biggest limitation for most of these use cases is the way that we are collecting and connecting all of our health data in a way that can support these applications. And we're certainly spending a lot of time and energy thinking about how can we position ourselves as a health fund within an ethical framework to use this data in a sensitive way for the benefit of our members. And that's really that core fundamental work that we all need to do. And we're a little bit behind given our fragmented system and different approaches to health data in Australia particularly, but also internationally.
Thank you. You've touched on that, but want to continue on the topic of integrating technologies, AI into healthcare. And given your background in both economics and medical management, what do you believe are the key factors to successfully integrating technologies, digital health solutions, AI, into healthcare system and insurance models? Are there any potential risks or ethical considerations that need to be addressed?
Yeah, absolutely. I mean, I think first and foremost, we need to understand the problem that we're trying to solve. And this isn't unique to AI and technology solutions, but there are a number of solutions in healthcare that maybe are looking for a problem to solve. So I think we need to reverse that and start with what is the problem we're trying to solve with this solution, and then doing a scan to identify the right solutions to that problem. And then clearly defining our program logic. What is the context for this problem? What are the inputs? What are the outcomes we're seeking? And what is the impact that we're seeking from this particular solution in the context of a complex integrated health system? Understanding your role in that and what solution you're trying to achieve. I think we can do better in defining our evaluation frameworks, how we measure the success or otherwise of these solutions. Often we commence programs in good faith and find it difficult to really put our finger on what is the outcome that we have achieved through this program. And that outcome can look at many things. We tend to look at the quintuple aim of healthcare framework as a benchmark to make sure that we're considering all the different elements of value in the health system. With a balanced kind of view. But I think, evaluating continually the effectiveness of these programs and how it fits with the ecosystem is important. I do think there's an opportunity for medical professionals and health professionals to really be leading the way in the implementation of AI solutions. And I guess the risk is if they don't, and other parties come in and implement these AI solutions, we may go down a path that may not receive the outcome that we're seeking. So I think as health professionals, we need to be proactive in exploring with curiosity these solutions and finding ways to integrate it into care pathways and health systems proactively. So look, I think there's some fundamentals on some things we need to consider when looking at these solutions. But equally, there are some risks with AI. First and foremost, we really need to understand where these AI solutions knowledge originates. There are some risks with large language models that are collecting a whole bunch of information from a whole bunch of different sources, and you really need to be clear on that. Understanding how that data is being interpreted, understanding the use case for that interpretation, and then also understanding how you're continually validating these models to make sure that they remain accurate. So I think medico-legally, there are some implications here when you start relying upon the outputs of AI with questionable explainability. It's difficult for medical professionals to justify their decisions based on the output of an AI model, which isn't clearly explainable. And I don't think we've really tested that yet in a real scenario, but I just don't think we're quite at the point that you can trust, or organisations would be willing to take the medico-legal risk of AI solutions without a health professional involved. There's regulatory implications in Australia. We have regulations for software as a medical device, and it's probably fair to say that this is a new field for our regulatory bodies, who are probably doing their best to understand the context and how they can regulate these types of devices, and ultimately they may be the rate limiting step. There are some sampling and historical biases that we need to be conscious of. An example is if you train an AI model on detecting cardiovascular risk disease in Caucasian males, it may not be so good at predicting cardiovascular risk in different populations. We need to be conscious of those biases. There's issues with automation bias. Clinicians may become too dependent on the outputs of AI and may not question actively those outputs. I mean, I reflect on early days looking at ECGs, and I had that little document at the top that said, we think this is this. And as a junior doctor, you're like, well, okay, who am I to question that? But the reality is we need to question those outputs, and we need to validate them. And then and hallucinations are still very much present. My litmus test is ChatGPT 4, which I have on my phone, and I use it quite a bit. But my kids and I do the New York Times Wordle. I don't know if you've seen that, Michał, but essentially it's a word guessing game, and it's a 5-letter word, and you put in a few words, and it gives you some clues along the way. And we tested this just yesterday. It was a 5-letter word ending in ER, and it had a K in it. The first attempt that ChatGPT gave me was a 6-letter word, and I pointed that out. And the second attempt was a 6-letter word again, and again I pointed that out. The the third attempt was a 5-letter word, but wasn't actually a word. And the fourth attempt again was a 5-letter word again that wasn't a word. And finally, after 5 attempts, ChatGPT gave me a 5-letter word that was a word. It ultimately wasn't the answer, but it just highlights the fact that I can't trust ChatGPT to give me a real 5-letter word with some very basic input. So I think we're a little way away from being able to use large language models for complex health interpretation. So that does concern me, that we become trusting of these models without really understanding how they arrive at their conclusions.
Yeah, black boxes. This is what we are all scared of, not knowing what the information is coming from and how to interpret it. So this is, I think we all, especially companies, AI companies, we need to work our way around that. And looking at future trends and innovations, what are some of these trends you anticipate in the health insurance industry? And following to this question, how is NIP Group preparing for these challenges? And what role do you envision AI playing in the future of healthcare management?
Well, I think ultimately a very big role. I think we're on the precipice of a healthcare revolution that will be driven by AI and novel treatments in the form of GLP-1s and new weight loss medications and genomics. I mean, I think it's an incredibly exciting time to be in healthcare. Scary as well, but exciting. AI particularly, it feels like an arm race in many ways. You've got MedGemini coming out last week with some pretty impressive results in MedQA. You've got ChatGPT on the other hand, as well as numerous other large language models that have got great promise. And I think that's really going to accelerate the trust that we can have in these models. And I think we're just seeing the beginning of the application in clinical care. So I think that will be revolutionary. I mean, as health insurers, we are committed and have a vested interest in keeping our people healthy and in the community. AI particularly can help us in that pursuit by understanding who are our members that are at risk and what is the best thing that we can be doing for them at any given time to keep them healthy and in the community. So obviously with over a million members, it's very difficult to do that manually. And I think AI can really supercharge our ability to identify those people that might benefit from programs that we're offering. So I think that's a really promising application in AI that we're just starting to think about how we might be able to use. I think genomics and personalization of care offerings is another emerging field. Again, I think we're just at the beginning of how we understand the gene and how we can use it to predict risk, but also how we can target treatment. And I think AI can be a great enabler for the adoption of care that's supported with genomic information. And then I think the broader piece is that when you recognise that our health outcomes are only really contributed to a small amount by the healthcare that we access, there are a whole bunch of other determinants that that impact our health overall, including social determinants and our behavioural actions. And I think AI can have a bigger role in understanding at any given time what is the most important intervention to improve someone's healthcare, which may not be the healthcare intervention. It may be giving someone a stable home. It may be improving someone's nutrition, and just really being more holistic in our approach to how we're improving and managing care. So look, I think fundamentally at NIB, we're exploring all of these use cases and just trying to really understand deeply what is our role in the health system and how can we contribute to the long-term health outcomes, not only for our members, but communities as a whole. So it's an exciting time.
That's true. Looking forward for the future. And to wrap up on a lighter tone note, Dr. McGrath, your career, as you mentioned, has also included time as a qualified maritime warfare officer with the Australian Defence Force. Can you share a memorable experience or lesson from your time in the military that has influenced your approach to leadership and management in healthcare in insurance industry?
Yeah, wow. Okay, it's an interesting question. I mean, I spent 15 years in the permanent Navy and another 6 in the reserve. So there's so many experiences that kind of contributed to who I am as a person and how I approach my career.
Yeah.
to this day, probably the most terrifying experience I had was as a maritime warfare officer, and I was the officer of the watch on the bridge, meaning that I was responsible for the lives of the 200 sailors that were busy about their work in the day. And I was bringing the ship into Shanghai Harbour at night and in restricted visibility. And I looked at the radar, and it looked to me like a map, which is unusual because you don't get maps on radar feeds because it's water. I quickly realised that they're all ships and they're all heading into Shanghai Harbour, and I had a little panic moment. I was like, oh goodness, I'm out of my depth. But I wasn't out of my depth. I did what I'd been trained to do, and I followed the procedure. And then we were coming down a channel, and I was about 500 yards behind the ship in front, and I heard the comms come through speed 0 for the ship in front. And 500 yards on a ship that's moving at 12 knots is not far. I don't expect your watchers to understand that, but immediately I just jumped into action and stopped the ship and went into full astern. But we came really close to hitting that ship, and it was one of those moments like this could have been a devastating event. But when I looked around the bridge, everyone on that bridge was very senior. The captain was there, the navigator was there, and they all had full trust in me, and I did my job. And we didn't hit the ship, and it was all good in the end. But it made me reflect upon a comment my captain had made about 12 months earlier that trust takes a long time to build. And she said to me, never be afraid to ask for help, never be afraid to be humble, and seek help from whoever will offer it. And over time, people will trust you, and they'll know when you're out of your depth. And I think the work that I did to that point leading into Shanghai to build that trust and ensure that everyone on that bridge knew I knew what I was doing, just re-emphasized to me that you've got to build trust over time, and you've got to know when you're out of your depth and know when to ask for help. And in the long run, that will help you as a person. And I think I've approached that outside of my military career and my health career, knowing where I don't know the answers and knowing who to rely on and who to ask for help. And I think AI is going to be like that for a lot of us as we start to learn how do we use AI and how can we adopt it safely. I think we need to come together and really trust in each other to share information and make sure we do it safely and sensitively. So there's many experiences in my military time, but I think that was the one that just really stays with me.
Thank you. And we've returned to the topic of AI. AI in the future may be a co-pilot, a companion of our daily lives. Today, my guest was Dr. Robert McGrath, the Chief Medical Officer at NIP Group. Dr. McGrath, thank you for joining me today.
It's a pleasure.
Thank you.